Well, the entire month is Mental Health Month, and we certainly hope you had an opportunity to watch our Mental Health Week content that we did here on Daytime Ottawa. We had some wonderful champions of mental health on the show. We also introduced you to some fantastic organizations, and we continue to do that. The Distress Center of Ottawa and region has been doing some wonderful work. I am joined by its Manager of Media, Marketing and Communications, Leslie Scott. Leslie, welcome back to the show. Great to see you. And, probably more meaning, Leslie, to Mental Health Month in these last couple of years than we've ever seen before, right?
Yeah, definitely. I mean, the pandemic really hit mental health really hard for a lot of people, people that have already been experiencing and living with a mental health illness. But really, it took on a new meaning when people that had never dealt with mental health before are suddenly dealing with anxiety, depression, and really seeing what mental health is like.
Leslie, did you see a dramatic growth in the numbers that were using your services, people calling into the Distress Center over the last couple of years?
Absolutely. We saw call volumes of over 60,000 calls the past 2 years, which is astronomical in comparison to just 10 years ago. When 10 years ago, we were answering half of those calls. So it's been a real big growth. And it's bittersweet, right? We want people to be reaching out and calling us and talking about what's going on in their lives. But it is hard to hear, how many people are suffering right now.
Leslie, when do you recommend people reach out to organizations like yourself for support?
As soon as you don't feel like your best self. Okay. If you're not feeling like your best self, it's time to sit back, think about what's going on, what's affecting your day to day, and then say, do I need some support right now? Am I okay to get through this on my own? Or, will a conversation be a good starting point for me?
We talk about sort of that mental health toolbox, and more people are looking for those tools to help them out. And since we have you here on the show, thought a great opportunity to ask you, what are some of the tips and advice that you give to people to help promote, their own mental health?
Yeah, so there's tons of great tips that you can find online or through your doctor. But a few of the ones that we have top priority are, first and foremost, eating well. We say good foods for better moods. It's so important to incorporate healthy food into your diet and try to stay away from the processed food as much as possible. Secondly, make sure that you're getting enough sleep. Right. Sleep is so important. Sleep is healing. Sleep is absolutely necessary for good mental health. And third, make sure you're taking your medications, if applicable, at the same time every day as prescribed. And that's so important because your body gets used to when, say, serotonin is being released into your body, whether you're taking anti-anxiety medication. It all depends on when you take it and how you take it, and making sure that you take it at the same time every day.
Yeah, those are three great things. And I'm glad you mentioned sleep, because I find, oftentimes you'll see on social media in particular something like LinkedIn where people are almost celebrating how little they sleep because they're working so hard, and they don't realize, what effect that can have on you. Maybe in that moment you're feeling okay, but it certainly builds up, doesn't it?
Absolutely. And, how having a good night's sleep makes you feel in the morning. And we want to aim for at least 7 to 8 hours a night. And, sometimes people, even moms and dads with little ones, say 7 to 8 hours is, not doable. Yeah. But it's definitely possible, and it's really important.
Leslie, I understand that you have an immediate need for volunteers. So, let's speak on that and maybe sort of the training and time commitment for volunteers.
Yeah, so training is 60 hours of training in-house with us for a commitment of 200 hours on our phone, text, and chat lines. The need is immediate because of the growth of our services, and we need to be there. We need to be able to answer every call, text, and chat that comes through our lines. And we need people for our May and June classes to fill up, and again in the fall.
Leslie, where does the majority of your funding come from for the Distress Center?
We do have our funding partners, of course, our local hospitals, United Way of Eastern Ontario, et cetera. But we really rely on donations from the community because we're not government supported, like many people think we may be.
Right.
We are a national charity, and we really depend on those donations coming from our community.
Well, with that being said, what's the best place for people to go if they'd like to help and make a donation?
Right on our website, which is www.dcottawa.on.ca.
Terrific. Can't thank you enough for joining us, Leslie. Always a pleasure having you on the show, and such an important, such an important initiative, right? To really reach out as you described when you're not feeling well. Don't be shy to do so. Thanks again.
Absolutely.
Really appreciate it, Leslie.
Thank you, Derek.
All right, take care. Don't go away. We've got lots more coming up here on Daytime Ottawa, including another great organization coming up later on in the show. We're talking the Boys and Girls Club a little later.